Namaste, I am Dr. Ayana, working as Assistant Professor, Department of Shalakya Tantra, Adichunchanagiri Ayurvedic Medical College, Bangalore. So today I am here to introduce about one of the branches of Ayurveda, that is Shalakya Tantra. So Shalakya Tantra, it is one among the 8 branches of Ayurveda. We have 8 branches in Ayurveda and Shalakya is one among that. So what Shalakya deals with? So Shalakya deals with the treatment of eye, ear, nose, throat and head and scalp. So in modern science we have specialties like ophthalmology and ENT. So combinedly ophthalmology and ENT together we have under Shalakya Tantra, that is one of the branches of Ayurveda. So Shalakya Tantra is also known as Urdhva Anga Chikitsa, because as you see all these parts are situated on the head part of the human body. So Urdhva Anga refers to the upper and Anga refers to the parts. So Urdhva Anga Chikitsa means it is the treatment of the upper part of your body. So all these organs are situated in the head, in the upper part of your body. And why Shalakya is considered as the supreme branch of Ayurveda? Because we know we have 5 sense organs in our body: eye, nose, tongue, skin and the ears. So leaving the skin, all the sense organs will come under the Shalakya Tantra. So as we deal with the sense organ, we can consider Shalakya as the one of the supreme branch of Ayurveda. And why sense organs are so important? We know that to enjoy the beauty of the life we need sense organs. We need the eyes to appreciate a good flower, and we need the ears to hear a good song, and we need the tongue to appreciate a good food, and we need the nose to smell something. So as the sense organs are very important, even the branch dealing with the sense organs are also very important. And we have many topics under Shalakya Tantra to discuss with. So in that, as the time is limited, we are going only with the ENT part, leaving the eye part, only ENT and its diseases and how we can prevent it. That will be dealing in today's session. So in each session, in ear diseases, what are the common symptoms and what are the common diseases and how we can prevent it. And even in the nose, what are the common symptoms, what are the common diseases and its prevention. And coming to the oral cavity, the common symptoms, diseases and the prevention. So starting with the ear diseases. So first we should know, whenever our ear is not in a good condition, so what will be the clinical features or what are the symptoms that we are going to experience. So generally the common symptoms are pain. People may complain of ear pain and even the swelling in and around the ear, and discharge coming out from the ear. So the discharge can be either any watery discharge or the pus discharge, and sometimes even people experience sound in the ear. And one more symptom is loss of perception of hearing. People feel that the hearing capacity have been reduced. So these are the few common symptoms people will experience when their ear is not in a good condition. So we should know what are the causes in general for the ear diseases. For a particular disease there will be a particular specific reason. So leaving that, we can generalize the causes, and so in that first one is rhinitis. So rhinitis is a medical terminology. We can, in a simplified way, we can understand rhinitis as the common cold. So whenever you have a common cold and if you are not going to treat it, the cold within a long duration of time it can spread to your ear. So rhinitis is considered as one of the reasons for the ear disease. And second thing is water sports. So whenever you are going for swimming or underwater diving in a contaminated water, the water can enter into the ear and it can cause ear diseases. And the third one is hearing to loud noise, very loud voice. And fourth one is hearing to the music or hearing to the music for a long duration. Especially the new generation, whenever they have time for relaxation, they will be hearing to the songs for long period of time. Over a long duration of time, even that can cause damage to your ear. So next is about some common diseases what we usually get in ENT OPDs. So the first one is CSOM. CSOM is chronic suppurative otitis media. In such cases, there will be pus discharge from the ear. inside the ear there will be an infection, and that infection will be coming out through the ear as the pus discharge. And the second condition is otomycosis. Otomycosis is nothing but the fungal infection of the ear. And third thing is ear wax. So these are some of the very common conditions what we generally get in ENT OPDs. So next, coming to the prevention of the ear diseases. So let me take any disease. The first line of treatment or first line of prevention is avoiding the causes. So causes we have already discussed. So as a first line of prevention, we should avoid all the causes. And next thing is precautions. We can take minute precautions to avoid the ear diseases. So we will see what are the precautions. First thing is, whenever we are going for any kind of water sports, whenever you are indulging in any sort of water sports, try to close your ear using a plug. So using ear plug while swimming and the diving, you can protect your ears. And second thing is protecting your ears from the cold exposure. Especially whenever you are traveling, try to protect your ear from the cold wind. And third thing, during the winter time, try to have hot water. So why this has given as a precaution means, whenever there is a rhinitis, whenever the people are affected with rhinitis for long period of time, even that can also turn to ear infection. So to avoid that, we should have only hot water during winter season. So that's all about the ear diseases. Next, coming to the diseases of the nasal cavity. So the common symptoms are, I think almost all of us might have experienced all these symptoms. Even if we are getting a minute cold, there will be the symptoms like sneezing, nasal blockage, itching of the nose, and even discharge from the nose. So these are the common complaints what we will get whenever our nose is getting affected. So what are the causes? So before going to the causes, we should know about the importance of the nose. Even though it is looking as a very simple organ, the nose is having very complicated structure. Inside the nose there are various defense mechanisms that is going to filter the polluted air whatever we are breathing. So unless and until we are alive on the earth, we breathe, and every time when we breathe, we take lot of pollutants, allergens and other toxic materials through the air. So nose is the only organ that is going to purify the air whatever we are going to breathe in. So the main reasons for the nasal diseases are exposure to dust and smoke, exposure to cold wind, and the water sports. And as per Ayurveda, other two reasons explained are excessive sleep and suppression of the urges. So why the excessive sleep will cause nasal diseases? So due to the excessive sleep, there will be increase of the kapha. That kapha can give rise to many diseases. And whenever we are going to suppress the urges, vata will increase, and even that can also cause many of the diseases. So generally we can say that these are the main causes for the diseases related to nose. So what are the common nasal diseases what we are getting? So generally the main disease is the rhinitis. So rhinitis is nothing but the cold. So it can be due to various pathologies. It can be an infectious variety or it can be a non-infectious variety. In infectious variety, it can be due to bacteria and the virus, and in case of non-infectious variety, it can be due to different allergens or due to pollutants. And the other common condition what we used to get is sinusitis. So rhinitis and sinusitis, these two diseases are very much interrelated. Whenever there is rhinitis for a long period of time, there will be nasal blockage. So that blockage of the nose is going to obstruct the drainage of the secretions from your nose. So whenever there is an obstruction, those secretions will get collected inside your sinuses. So we have frontal sinus here and maxillary sinus here. So all the secretions will get collected inside your sinus area, and it is going to give rise as sinusitis. So you will end up with sinus headache and other problems. So we can say sinusitis is a complication of rhinitis, or many times both the things will coexist. So there is another disease known as rhinosinusitis. Same time there will be cold, and at the same time there will be sinusitis. So how can we prevent it? So as I have already said, for the prevention, first thing is avoid the cause. So causes already we have discussed. So we should try to avoid all the causes. Next thing is precautions. So what and all precautions we can take? So whenever you are going to a cold area, or whenever you are getting exposed to a cold atmosphere, try to cover your head and make yourself warm, so that we can avoid diseases related to the nose. And next thing is wearing a mask. So whenever you are in urban area, or whenever you are in more polluted area, to avoid the dust and smoke, always try to wear a mask. And during the winter season, always try to have hot water. So next, coming to the diseases of the oral cavity. So oral cavity, especially for school going kids, it's a major problem, because kids are more fond of chocolates and sweets and ice creams. So all these artificially sweetened food and creamy foods, chocolates, etc. can cause oral diseases. So what are the common symptoms? So we have many organs inside our mouth. So generally the complaints what people have whenever their oral cavity is affected are the tooth pain, gum pain, and even swelling over your face, and even the bleeding. So whenever you brush, you will have bleeding from the gums. So these are the common complaints. So what are the causes? As I have already explained, artificially sweetened food and even sweetened drinks, these are the main causes. And the first and foremost thing is the improper hygiene of your oral cavity. So especially kids will be having aversion towards brushing the teeth. So if we are not keeping our oral cavity in a hygienic way, that can also, there will be attack from the bacteria, and there will be lot of diseases. So how the sweetened foods, only the sweet foods and creamy foods, how they are going to affect your teeth? So whenever we have lot of sweet foods, the bacteria will act on the sweet foods, and it will convert the sweet food into an acid. So that acid will try to damage your teeth, and even there will be plaque getting deposited over your tooth, and over a period of time that infection can even spread to your gums, leading to gingivitis. So what are the common diseases? So usually related to oral cavity, we get the cases of tonsillitis and even throat pain. Usually what we say as throat pain is pharyngitis, and even tooth decay and the gingivitis. So gingivitis is nothing but whenever there is a plaque, that infection is going to be affected to the gums and giving rise to gingivitis. So how can we prevent it? So first thing is avoiding the cause. Try to avoid as much as sweetened food, artificially sweetened drinks, and always have a hygienic, or always try to maintain the oral hygiene. So what are the precautions? So to have a to maintain your oral hygiene, we have different techniques, like we can you can have brushing. To say it's a very simple technique, but none of us brush in a proper way, especially kids. Only the upper part of the surface they will be cleaning, but by means of brushing we need to clean all the parts of the tooth. We have to clean the behind surface of the teeth, even the upper surface, lower surface, all the surface of the teeth has to be cleaned properly twice in a day. And the brushing should take at least 2 minutes of time. And even with the brushing, sometimes in between the area, like interdental surface, between the tooth, the area will not be cleaned properly. So to clean that, you can use interdental brushes. And to prevent the entry of bacteria and to avoid the bacterial infection, you can also gargle once or twice in a day. And during the winter season, always try to have boiled and cooled water to avoid the infections. So next is very important thing, role of Dinacharya in preventing ENT diseases. So Dinacharya is a unique concept of Ayurveda, wherein Acharya have explained lot of procedures that has to be done daily. So Dinacharya, the word has two words, Dina and Charya. Dina refers to day and Charya is the routine. So Dinacharya refers to the daily routine. So we need to do many things to make ourselves healthy. So related to the ENT, whatever Dinacharya Acharya have explained are Shiro Abhyanga. Shiro Abhyanga refers to massaging your head with oil. So how this will help? So whenever you massage your head with oil, it is going to improve the circulation of that particular area, and as per Ayurveda, it will reduce the Vata. So once the Vata is reduced, it is going to give more strength to your sense organs. And next thing is Pradimarsha Nasya. So Pradimarsha Nasya means we have to put or we have to instill 2 to 4 drops of oil into each nostril. So what will happen whenever this oil is going through the nose and when it is coming out through your mouth, it is going to clean or it is going to take away all the discharges from the upper respiratory area. So it is going to clean all the passage. So whatever extra secretions are there, whatever extra kapha is accumulated, it is going to take out or it is going to eliminate all the toxins from your upper part of your body. So in that way we can keep the nose clean and even the respiratory passage more healthy. Even the local immunity or local defense mechanism will be more strengthened with Pradimarsha Nasya. And next is Dhumapana. So Dhumapana refers to the inhalation of the medicated smoke. So whenever you take smoke is not the usual smoke. Whenever you take a medicated smoke, it is going to dry up all the secretions. So whatever secretions are left over, that secretions will be dried up by the medicated smoke inhalation. So in this way, due to by following Pradimarsha Nasya and Dhumapana, we can make our upper respiratory pathway very clean and we can eliminate all the toxins and discharge from the upper respiratory pathway. And next is Gandusha. So Gandusha is different from gargling. So by the picture or many people take Gandusha as gargling. So Gandusha is a different concept from gargling. So in Gandusha, what we are going to do is we are going to fill our mouth with a medicated decoction or even any other liquid, medicated liquid. We have to keep it in our mouth for around a stipulated period of time, around 5 to 10 minutes, and we need to rinse our mouth with that and we have to spit it out. So with this procedure, all the toxins, how the Pradimarsha Nasya and Dhumapana is going to eliminate the toxins from the airway, in the same way Gandusha will help to remove all the toxins from the oral cavity. Even it will help to improve the local defense mechanism. And next thing is Danda Dhavana. Danda is teeth and Dhavana is cleaning. So in olden days, rather than brushing, medicinal twigs have been explained for cleaning our teeth. So these twigs also having medicinal property and it will help to remove all the toxins from our teeth and it will help to fight against the bacteria, because most of the medicines which were explained for the Danda Dhavana, they have medicinal property, and even in the studies it has been proved that they have anti-karyogenic property. So it will prevent even the dental decay. And the last one is Jihva Nirleghana. Jihva Nirleghana is nothing but cleaning your tongue. So it will also help to improve your taste perception and even it will eliminate all the bad odor and even the toxins from your tongue. So all these Dinacharya daily routines explained in Ayurveda is relevant to prevent as a preventive modality to prevent all the ENT diseases. So next I would like to introduce a herb. Actually it's a combination of 3 drugs. So we call it as Triphala. So 3 is the 3 number and Phala is the fruit. So Triphala refers to a combination of 3 fruits. So I think from the figure it is clear that one among that is very familiar fruit. Amalaki we say in Ayurveda and Nellika in Kannada. So we will take the fruit and we can dry it and make it as a powder. And next one is Haridagi. In Kannada it is known as Alalekai. Same way how Amalaki is powdered, in the same way Haridagi is also powdered, dried and powdered. Third one is Vibhidagi. It is known as Tadekai in Kannada. Same way it is also fruit, it is dried and used. So commonly the used part is fruit and the commonly used form is ghee or the powder. Either in market it is available as a powder or as ghee. So the Triphala is processed in the ghee and Triphala Grida is available. So Triphala is a miraculous drug. We can say Triphala is a miraculous drug because Triphala is having many properties. The 3 drugs in the combined form, it can have multiple actions. So we can say that It is having antioxidant property. Antioxidant means it will prevent the damage to the cells, thereby we can prevent aging. So that is antioxidant property. And next is anti-inflammatory. It is going to reduce the inflammation or swelling anywhere. If swelling is there, it is going to reduce that. Next is immunomodulating or immunobooster. So even Triphala can improve your immunity, and it is also proved that it is having anti-stress activity and antibacterial activity, and it is also a very good hypoglycemic. Hypoglycemic means it can reduce the blood sugar level. So Triphala is having many uses in Shalakya practice. So whatever related to ENT I would like to explain. So Triphala as Rasayana, it's a very good rejuvenator. It can improve your immunity, it can prevent aging. So for that we can take Triphala Churna, the powder of Triphala, 1 teaspoon every day, either in hot water you can take or with unequal quantity of ghee and honey night. At night you can have. With this it can even prevent aging, and it can it can reduce the blood sugar level, even it can reduce the acidity, and it's very good for your vision. So many uses are there. And in the preventive aspect in oral cavity diseases, we can give this as Gandusha. So Triphala Churna, we can prepare a kashaya out of this, and that kashaya can be filled in the mouth, and we can use it for preventive aspect. So how to prepare that kashaya, I will explain. You have to take 1 teaspoon of Triphala Churna and add 4 glasses of water. Boil it thoroughly for 5 to 10 minutes. Then you have to filter it. If needed, you can add little bit salt. And then fill the mouth with that kashaya, warm kashaya, up to its full capacity, and hold it for around 5 to 10 minutes. Then after 5 to 10 minutes, you can nicely rinse the mouth with that kashaya and spit the kashaya. So if you regularly do this, we can prevent even dental caries and even gingivitis. It is good to clean your mouth. So another use is, so those who are getting repeated infections like repeated tonsillitis, repeated pharyngitis, for a preventive aspect, you can even add to the same kashaya, you can add tulsi, pepper and ginger. All these things you can add. And for the preventive aspect to the tonsillitis and pharyngitis, you can use as the Gandusha. Gandusha is nothing but filling the mouth with that kashaya and holding it for 5 to 10 minutes. So to the same kashaya you can add pepper, ginger and tulsi and fill the mouth with the kashaya. So these are some of the, this is I explain only for the preventive aspect. Those who are actually suffering with tonsillitis and pharyngitis, they should consult a doctor and they should take the medical advice. Only for the preventive aspect you can have the Triphala as a Gandusha. So with this we will come to the end of the presentation. So I would like to take this opportunity to express my sincere gratitude for KRES and our beloved principal for giving me a great opportunity to present today. Thank you.